All right. I'm going to end us on that picture since it is our first graduating class from the Healthcare MBA. It seems like the fitting place. And welcome you all to this amazing conversation about the student experience within Bentley's Healthcare MBA. I am Emma Emmer. I am Executive Director of Strategic Programs here at Bentley, and I am thrilled to be here with three amazing individuals who can speak about the program. I'm going to have them introduce themselves just to give you a sense of how we'll spend our time. We'll do really quick introductions. I will give the briefest of overviews of things to listen for within this conversation for the Healthcare MBA, just to ground us in what I think makes this program so special. Then Iris Bergero will lead a wonderful conversation about the student experience. And then we'll hang out till the end and talk a little bit about the application process and questions folks might have about that. I hope people on the line will use the Q&A feature to let us know what they're curious about. We certainly will try to integrate your questions into the conversation or have some Q&A at the end. Those questions can certainly kind of range from things about the student experience, things about the application process, and everything in between. So please use that liberally. So with that, Iris, I would love for you to start by introducing yourself.
Sure. Thanks, Emma. I'm Iris Bergero. I'm a professor in the management department here at Bentley University, and I'm also the MBA director and have been part of both the design and the implementation of this program for years now. And so I'm really excited to be here and talk about it and to introduce our guests today.
Awesome. Well, Annie, would you love to introduce yourself, please?
Hi there, everyone. My name is Annie Chen. I am an executive assistant at New England Baptist Hospital, and I am currently in the third and final year of our program, and looking forward to finishing this nice and strong.
That's right. Last semester. This is huge. And Anya, I'd love for you to introduce yourself too.
Yes, hi everyone. I'm Anya Russell. Annie and I are in the same cohort, so I'll also be graduating in May. I'm a program manager at BIDMC in the neurology department, and I've been at Beth Israel coming up on 5 years.
Wonderful. Well, thank you both so much for being here. You both, as kind of, we'll call it, our graduating class, certainly have lots of insights on why'd you choose to do this? How's it gone? What have you learned from it? How have you integrated it into your day to day? And what advice you would give to people who are interested in it? Before we get to that, because I know that's really what everyone is here for, I do just want to, as I said, ground us in a couple of kind of key features of the program that I think are important for folks to know. The first is that the Healthcare MBA is designed specifically for professionals in the healthcare industry. Now, you're going to say, Emma, duh, it's a healthcare MBA. Well, I'm not sure that's always true across other programs that have healthcare flavors. And the reason I can kind of say with full kind of comfort that this is true at Bentley is first and foremost, this program was designed alongside a major hospital system here in Boston. And there was influence from that group on the actual curriculum. And so you see that the coursework is really designed specifically to serve the needs of their employees and therefore the larger healthcare industry. I think similarly, and you can see this in kind of our four key points about the program. Bentley also is uniquely set up to have to lead a program on the business of healthcare. So we have a Center for Health and Business on campus, which has over 90 staff and faculty affiliates that are doing research or work at the intersection of business and healthcare. And this program leverages their work as well as the faculty who are associated with the center to teach coursework. And so I'm sure Anya and Annie will talk a little bit about that and how faculty members are bringing their work into the classroom. Similarly, because of that, all of our coursework, so even our foundational coursework, all the way to kind of what Annie and Anya are working on, which is their kind of final healthcare elective, are infused with healthcare examples. So this is not a program where you're taking your core business classes and there's no association with healthcare, and then you kind of get to the end of it and there's some healthcare examples infused in some electives. Throughout the coursework, even, your earliest foundational coursework in, for example, economics, is going to be with the lens of healthcare throughout it. You also are going to be learning alongside healthcare industry professionals, and their examples and their lived experience are also going to come out in the classroom, and that's really going to influence the way you learn. The last thing, and frankly, I think the thing that Annie and Anya can speak to better than Iris or myself, is how this program fits into working professionals' lives. It is structured so that you can work full time and still be fully immersed in the program. As Annie and Anya said, it's a 3-year, just under 3-year long program, with all of your coursework online. And when it's live in the evening, although some of the coursework is kind of a choose your own adventure, do it on your own time type of course. And so we really work to make sure that students can fully commit to their employment as well as fully commit to what is a very rigorous program. And so I know we're going to want to dig in with Anya and Annie how they've been able to navigate all their responsibilities at the same time. And so with that, Iris, I am going to stop talking and I'm going to pass it to you so that you can have a wonderful conversation with these amazing soon-to-be graduates.
Great. Thanks, Emma. And it is really exciting. That last picture that you saw was our first graduating cohort. We do have a big celebration for each cohort when they do graduate. So Annie and Anya, I'm looking forward to seeing you guys in that celebration. But one of the questions that we often get is, why do I need an MBA? What is this going to do for me? And so I'm wondering if you can just introduce yourselves a little bit and tell us why you decided to take this healthcare and MBA. And Anya, maybe we could start with you.
Yeah, that sounds great. So as I mentioned briefly before, I'm a program manager in our neurology department. I had started off as a research coordinator at the hospital and wanted to grow in the hospital setting. And for me, I had just been promoted to a program manager around the time that I decided to do the MBA. I was going from an individual contributor role to a manager role of a team. And it was a team where we've been expanding. And I thought, and my boss helped encourage me uh, to think through what skills I might need and would be helpful for me to continue growing in this role and help support our program. So for me, my goal is for my career to be in hospital administration, and um, the MBA was a great way to help support me in learning more about leadership and project management that would help in my role.
Anya, that's great. And it really points to the benefit of an MBA as you're moving from a pretty functional area to one that's more aggregate, moving up in the hierarchy, working more with teams and taking on leadership responsibilities. That's really where an MBA can help you out, right? Annie, how
Yes.
about you? Why did you decide to take the healthcare MBA?
Well, currently I am an executive assistant for the Department of Orthopedics and Medicine. But actually, before that, I started off as an athletic trainer, so I was more so clinical. So I had built my whole career off, treating patients and being having one-on-one communication with the community. And I had then worked my way up to almost managing most of our clinic. So I felt as though I wanted to make more of an impact in the strategic part of how our clinic was run. So then I made the move to change my whole entire career because I wanted to make more of an impact in my community and in the healthcare system. So I took a leap of faith and transferred into the administration role, where I'm currently an executive assistant. And from there, I've been communicating with a lot of different departments throughout our hospital, ranging from cardiology to orthopedics and working for the president's office as well. So I wanted to learn more about how I could make an impact in the hospital system in general that I grew up in, and also helping those who don't have that access. So it was really important for me to give back to my community that way. So that's why I pursued this MBA, because I felt that it would guide me to that path.
Annie, I love that. And so for you, it's slightly different. It's being able to completely pivot and redefine yourself and get into a different space within the organization. But you also mentioned that being able to improve and positively impact the organization, right? That's what we all want to do, regardless of where we are in terms of our functional area or our hierarchy or what our job is. We want to positively influence the outcome. That's super. Thank you both. So let's dive more specifically. And can you talk about, you've taken a lot of courses. You're near the end of your program, and so you've had lots of experiences. But can you maybe pull out one and tell us about a course that really made an impact on you and your current role, and maybe why it was impactful?
I can start.
Oh, yeah.
Oh, sorry.
I did
Um,
direct, and that's what happened.
um, for me, it would be our very first course in our leadership class. It taught me that leaders aren't always the ones that are just saying, here, do this, do that. And as a supportive role, I have learned that, you know, you can take a leadership role in a different sense, even though you support. So, and there's also a lot of interpersonal dynamics that comes with becoming a leader in the healthcare system. So it made a huge impact on like how I view other departments, different leaders, and also the people that are frontline workers, and how to further understand what they need. So that made a huge impact on how I go about communicating with individuals that I have to work with to get a plan going and to move a project forward.
Annie, you really pointed out that, we often hear terms like leadership and we think we know what it means. And then when you unpack it and really understand what that concept is all about and how you can actually enact it, that's the courses should lead you there. And I love that you picked that course. Marcus Stewart is one of our superstars. And so really happy that struck a chord with you. Anya, what about you?
Yeah, I completely agree with Annie. I think having that leading responsibly class as our first class was really kind of set the stage for our cohort and us as a MBA class going forward. Another class that I think was one of the most impactful for me was we took an accounting class with Professor Wolf. And I I think this program has been really nice because there are project management and leadership classes that help refine some of the softer skills of working, but then having accounting and finance classes also, especially for me, I've been trying to learn more about the financials to help make larger decisions and to have a class that was really dedicated to that and doing projects to understand how all of that works. I thought she did such a great job of explaining that because I didn't have a finance background. I was more of a science background coming into this. So it was really nice to get that.
You point out that the first course that you get is leadership. We have specifically patterned the courses that students take in a specific order so that when you come in, there's sort of a softer on ramp because we understand that people may not have been in school and formal education for a while. You're trying to figure out how are you going to fit this all in, and so we don't want to overtax both your brain and your scheduling with really in-depth courses. But the leadership course is just as in-depth. It's just in a different way. But Anya, I love that you tagged Lynn Wolf and the accounting course. We hear a lot that, oh my gosh, accounting and finance, this isn't my language at all. I don't know how I'm going to get through this. And without prompting, Lynn Wolf is always brought up as one of the superstars of the program because she makes accounting accessible. And Trevor Larkin with the finance course as well, they make it accessible to people who don't have that background. And that's one of the things that we're very conscious about in designing this program. So let's switch and talk about your cohort. Tell us a little bit about what it's like being in a cohort program. So you start and finish at the same time, you take the courses together. How has that impacted your learning? And Annie, let's start with you again.
Um, at first it felt intimidating because when I first started, I was like, oh wow, there's nurses, there's doctors, there's a CMO in our cohort. But, throughout the years and the semesters that we've worked together, it's actually great to get a different insight of, these different roles when it comes to working on our projects together. So, and we've actually become really great friends. And like Anya and I work together on many projects together, and like we work so well as like a team. So, and coming out of it, it's like, wow, like, once we graduate, I'm gonna have this great connection, and like we can both like encourage each other to move forward within our careers. So that's one of the highlights of this, the mixing of different people and different backgrounds.
That's great. Anya, I'm going to let you throw some acknowledgments back.
Yes, yeah, Annie is so great to work with. And I think our cohort has also just become so comfortable with each other. I feel like I've learned maybe not equally, but so much from my peers as I have in the courses, just because I think the courses are designed with the healthcare lens, but the professors aren't working in the hospital. And so when we have our class discussions, I feel like we're gaining so much more from the conversation that we have of the nursing perspective or the admin perspective from people who are in the C-suite or just on the ground working. So that's been really nice.
Yeah, that's super. I mean, everybody within an organization has a particular line of sight, right? There's certain things that you're very familiar with, but you work within this whole organization and you don't often get a chance to see what it looks like from other people's perspectives, right? From other people's roles and responsibilities and the language that they use. And bringing all of that together in the classroom is that interdisciplinary perspective really gives you insights that you don't always get in the organization, right? And so it gives you an appreciation for what the whole is like and what all of those other components are. And a couple of stories that I've heard that I just love. One was, now I walk down the hallway and if I see somebody in my cohort or that I know is in the program, there's a connection there and we can stop, we can chat, we can say hi. And I wouldn't have had that if I didn't know them through this common experience, right? And the other thing that I loved, we did an information session and had a panel of students, and it was right before the holidays, before the Christmas holidays and New Year's, and they were going on vacation together. And we're really excited about, having this new pool of friends that they could do things outside of the program with, which is just really fun to watch. We design it with that intention, but then to see it and to hear from you guys how that actually plays out is really exciting. So, but the program's not easy. It's a lot of work. And, as you have both pointed out, you're working full time, you've got professional commitments, you've got personal commitments. So how do you balance the program with all of these other responsibilities? And what advice would you give to others? And maybe Anya, we can start with you.
Yeah, I think It was it was nice to start off. I don't know if this is the plan going forward, but we started off, I think, having some synchronous classes and some asynchronous classes. So I think that was a nice way to kind of gradually get used to the workload and do things on your own pace, but also committing to that class a week. And then eventually there have been some where we've had a semester where it's two synchronous classes, so 2 nights a week. And I think it really just comes down to organizing your schedule. I think it's very manageable, doing it while working full time, but it does take um, some weekend time, some time in your nights to do the assignments and the readings, which I think the professors try to be very conscious about what they're assigning to. A lot of the readings are case studies that we're going to discuss in the class, so it feels like it's very intentional what the work is that we're doing.
Right. Annie?
Um, I will echo what Anya said. It's just time management. I know that a lot of us will ask about the syllabus way in advance. So we will then have a group Slack and we'll either remind each other, hey, like this assignment's coming up, or oh, what do we think? How did you guys start this project yet? Or, so we all kind of keep each other in check. But I think, like Anya said, it's pretty manageable. For some classes, I'm not a finance person at all. So it took me a little bit. I definitely gave more time on those courses as opposed to some other ones that I was more comfortable with, but overall very manageable. And our professors were so great. I remember Lynn Wolf would spend almost every night with us on Zoom for weeks and weeks trying to get through problems. So I think our professors are very supportive. So, I think with that and, spending, I would say like 3 hours, a couple nights a week. Like, I think it was manageable.
That's great. I
Iris?
mean, sorry, Emma. Yeah.
Sorry to interrupt. There's a related question in the chat that I thought maybe I could ask since it's related, which is about how supportive is the faculty when life circumstances come up? So if you have, oh my God, I have this horrible deadline at work and it's intersecting with a deadline I have for my course. Have you guys had experience with the faculty helping to support you navigate that type of thing? And then, Iris, I know you can speak from a philosophical perspective what Bentley thinks about that, but I'm curious if either Annie or Anya have had any experience with navigating kind of intense moments within their 3 years.
Yeah, I can speak to that. I actually have a family that's really sick currently. So I did notify my professors about there will be some days where I won't be able to make the class, and they're very supportive. So and sometimes they'll give us extensions if it's really difficult for us to get things handed in time. So I would say pretty supportive. But I would recommend, talking to them in the beginning and just saying, hey, this is what my family circumstances are right now. Or, we have a lot of, like, for example, I've had meetings, that run into class start times and they understand that too. So,
Yeah, I'll just again kind of repeat what Annie said, but I think they really treat you like a working professional. They're not treating you like an undergrad. I think there's a lot of trust from the professors that you're here because you want to learn. And so as long as you're communicating with them what your schedule is, I haven't had any issues with them, yeah, with a deadline or needing to come late to class or leave early on vacation.
Yeah, I mean, I absolutely agree from our perspective. We understand that you're all working professionals and that things do come up. And as long as we get a heads up, and both of you, Annie and Anya, have said, you communicated with your professors. We deal with students like they're adults. And so we make accommodations. And, even to if there are extended periods of time, we'll figure out how to manage that. So the key is to really work with your professors and to give them a chance to come up with some alternatives and understand what's going on. But some of the other things that I heard, Annie, I love that you pointed out the peer support. That you help each other out, because this is really the beauty of a cohort, is that you do have these other people that are in your professional context and also experiencing this academic thing together. And some people will be more familiar with accounting and finance, and maybe leadership sounds a bit like a strange animal to them. And so that shared, even though you don't all have the same strengths and skill background, but that shared support throughout it. And Anya, you talked about the different modalities. So the courses are you can do the entire thing online. You don't have to come to campus, so it is accessible. Some of the courses are offered what we call synchronously. So you will have a class session like this on Zoom. Other ones, the course is asynchronous, and so it's self-managed and self-paced, and you get through the materials on your own with the faculty are there. You have optional class meetings, you have office hours, but it's more self-paced. And so there are different modalities, and we do try to mix it up until you sort of get used to this pattern. And then in the last semester, you have one course left before you get to start thinking about how you're going to celebrate. And I will say one other thing about the celebration, and the way that people get through the program. When our first cohort graduated and I was at the ceremony, we have a reception for the healthcare MBA grads, and many brought family with them. There was really quite a crowd of people there in that celebration. And one of the women that was graduating, her husband and two small children were there. And so I was talking to Dad a little bit, and so I said to the kids, "Are you excited about Mom graduating?" And they said, "Yeah, we really need Mom back. Dad's a terrible cook." And so you figure out how to get through the program, and it is a negotiation with your family, with your employer, with yourself about, what are you going to commit to this and what are you not going to be doing in the time that you are engaged in this program. So thank you both, Annie and Anya. You've got great insights and really represent the program well. And so at this point, I'm going to throw it back to Emma.
Awesome. Yeah, I'm going to talk a little bit about the application process, and then I hope folks will put more questions in the Q&A for Annie and Anya that we certainly can go through. But let me talk a little bit, as I said, about the actual application process. And so we try really hard to balance two things in our application process. One is a deep desire to really get to know you and why you think an MBA is going to benefit you, with not making the application so onerous that you are unlikely to be able to finish it. And so you can see here the application requirements. They are quite, I hope they are seen as not being particularly rigorous, but they are really important because I get to read all the applications for our students. I need to get to know you so that I can advocate for your admission to the program. A couple of things I really want to call out here on these requirements that are important for you to think about. The first is the recommendation letter. We really ask that that be a professional recommendation since you all are working professionals. We want to understand you in your work context. So we hope that you could ask a current or former manager to complete that recommendation. Similarly, as Iris said, we do know that this program requires sometimes navigation with your employer on having the time to do this. We have folks that work shifted shifts, and on the day that class is happening, they have to trade and things like that. So we certainly hope that you're talking to your manager through both the recommendation letter and your consideration process about the program. Another thing I want to call out is that we are entirely test optional, and I really mean optional. So if you happen to have taken a GRE or GMAT recently and you're proud of your score and you want to send it to me, great. If that is not something that is at all something you've thought about, do not take it, please. We are happy to look at your application without the test score. The last thing I want to call out is the transcript. So, as Iris said, this is a working professional program. We expect that many of you have been working for quite some time, and that, as one of your colleagues or one of the cohort members famously said to me, his transcript had a bunch of cobwebs on it. Like sometimes it's going to be from quite a while ago. It is not something you've thought about in a while. All good. We want to see it to understand how you've navigated academic experiences. But remember, this is a working professional program where we are holistically considering your application. So equivalently, we're thinking about your work experience, your recommendation, why you want to do this program. And so don't stress about it. We would love to see it. And we know that you might be different than your 21-year-old self who graduated from your undergrad degree, and we respect that and completely know. Last thing I just want to say is that we do have some upcoming dates. So our final application deadline for the program is May 1st. We welcome your application anytime, though, between now and then, and we read your application on a rolling basis. So if you submit sooner than that, you're going to receive your decision within something like 2 weeks of you submitting your application. The benefit of applying earlier is that you will know if this is something you need to start planning for. And so we really want, as both Anya and Annie talked about, you want to think about, okay, I'm going to do this. How does my schedule have to get structured? How am I going to fit this in? We want to give you as much time to do that as possible. The other thing is, very earnestly, we do not allow more than 35 students in this program each year. And certainly, we don't want you to apply so late that we come back to you and say, unfortunately, we have to wait till next year because the cohort is full. Classes will begin in late August. And so if you're curious about kind of when you'd be re-entering the classroom, it is just before Labor Day. Last thing I'll say is we do have a partnership with a couple of healthcare systems, namely Beth Israel Lahey Health and Dana-Farber Cancer Institute. If you are an employee of one of those two places, we do have a special partnership that allows students from those two institutions to have a reduced cost to this program. If you have questions about that, please reach out to me. I'm more than happy to share what that looks like and how that's structured. And so want to make sure that folks from those two areas are reaching out if they have any questions. I'm going to put in the chat in just a second once I come off screen my email address. As I said, my great desire is to get to know all of you as you consider this process. I speak to folks about this program every week individually and really would relish the chance to hear about why you're thinking about this and support you through the application process. So with that, we do have a couple of other questions. So the first one is easy, right? Which is preferred GRE score range. I would say since we are test optional for this program in particular, actually across the grad school, I'm not going to give a score range that we're looking for. I think this is really a question of, do you think it adds to my understanding of you in an academic capacity? So is it meaningfully different than what your transcript would tell me? Are you proud of how you did? That's really how I would urge you to think about the GRE score. So that is a easy and straightforward question. Here's a good one. Anya and Annie, I'm curious from your perspective, and then Iris, I would love again for you to speak about it from kind of a philosophical perspective. There's the question, in terms of the structure of the program's curriculum, is it more of a written essay, project, or exam-dominated program? So what I hear in this question is, how are you being considered? How are you engaging in coursework? Because business coursework is very different than coursework in other fields. So I'm curious, either Annie or Anya, if you could speak to that.
Yeah, I can start. I think every single class we've taken has had a project component. I'd say that's one of the biggest parts of getting to know your peers, and um, the projects have been worth a good amount of our grades each class. And not every class, but I think wherever we've been able to, the professors allow us to have some flexibility of what project we're doing so that it aligns to our work. So either like creating, like for a project management course, the project that my team worked on was trying to expand the program that I'm working on in my day to day at work. So that was a really nice way to take something that I was doing at work already and just formalizing it in the proposal in the school setting.
We also engage in a lot of discussions in class. Um, and I would say only a handful of classes require us to take an exam. But either way, like we've gotten a lot of review support from our professors. But I would also agree with Anya. It's mostly project heavy, with presentations, and then just discussions during class.
Iris, can you talk a little bit about why that's how an MBA is structured? Because there's a lot of thought behind that.
Yeah, I mean, I just want to clarify that there's group projects, there's individual projects. I'm guessing that you guys also, you mentioned doing cases and you might have to do case analyses, as opposed to, multiple choice, true, false testing kinds of things. And the philosophy behind that is one, learning is a social phenomenon. So through case discussions or group work, you learn a lot by engaging with your peers and going through that learning process with them. The other, in terms of the projects, I know you mentioned being able to use your own context, your own organization, and opportunities for those projects. And we've heard that from a number of faculty. They specifically offer that opportunity and look for that opportunity. And students have done some really cool things within their organizations. And the point behind that is that you take the conceptual knowledge that you're gaining, sort of the theories and the models, and you're looking for how do you apply that in a real setting? Because in a real setting, the data doesn't come to us in a neat model, it comes to us messy. And so we want to have that opportunity to say, okay, conceptually, I understand this is best practice, but how does this actually look in my organization? And if I wanted to improve that, how would I use what I learned in the classroom to manage that in my work setting? On the flip side, the reason that we have a lot of in-class discussions is because you can take that work experience and bring it into the classroom and say, hey, this is what it looks like in real life. Like, how do we sort out this gap between, this model of best practice, which, the perfect manager is going to do this, go find the perfect manager. And this is what actually happens. And so how do we sort that out? And that makes the class discussion so much richer. So we always look to a balance between assessing an individual's contribution and assessing their contribution to a group. Because the other thing is, it is very rare that we do anything individually within our organizations anymore. We're always working in and with other people. And so we need to learn how to do that. And that's why we assess in those different methodologies.
Absolutely. Iris, I'm going to take 1 second to share a little bit about some of the projects that we've heard about. We've heard about some recently that are just fascinating. So, one that I heard about was in one of the courses, a group came together to talk about language interpretation services at one of the hospitals. And what they identified, and I don't know, Anya or Annie, if you were involved in this at all. Um, Annie, I don't know if you want to tell this story instead of me because I can tell my version of this story, but if you lived it, I'm curious from your perspective. But the story I was told was that the group came together and identified that there were some major gaps in being able to deliver that kind of language interpretation service at the hospital and leverage kind of supply chain and other structures to and theories to identify opportunities for change. And not only did this happen in the classroom, it then was actually brought to the hospital system and became a working group at the hospital system because the recommendation was so strong and that there was a clear issue, and then there were some real business solutions presented that were then going to be leveraged at the hospital level. And I think, as Iris is speaking about, the beauty of doing a working professional program is that, as Anya said, you bring yourself into the classroom and you bring the classroom right back out, right? And very quickly you start to see, oh, remember that thing we talked about in leading responsibly? This is showing up 2 days later, and I got to rethink this. I think that was a really interesting example of, frankly, a course where I think some people sometimes look at it and go, oh, I don't really understand how does this how is this going to benefit me or my understanding of the system, and then immediately saw, wow, we could apply this theory and make a huge change in our patients' experience. Annie, did I totally make up that story?
Oh no, you're correct. I was part of the group that did the class project regarding the translation services. And what we had found was that across our different hospitals, we all had a different line of translators. So like one
Mm.
hospital had one certain um tool for getting translators, as opposed to, like, for example, my hospital had like a line, like a phone that, they called. But one of our physicians that are in our cohort, she brought it to Leahy, and that's when, again, like Emma said, it became this work group, and she was able to get funding to get those services brought to Leahy.
Kind of unbelievable. It's amazing. We have one last question in the chat, which I think is a really important one, which is the average number of years of professional experience that students have before entering the program. I'm going to start answering this, and then Iris, I would love for you to weigh in. So, we typically, as you hear, this program really benefits from people having professional experience that they're able to bring into the classroom and kind of bring this experience out of the classroom. And so we really urge people to have at least 2 years of working experience before starting this program. Now, there have been there is flex on that for the right candidate and a candidate that shows why they have kind of the applied practice that goes beyond their kind of written number of years of professional experience. However, that is absolutely the lower bound. I would say on average, we see closer to, I would say, kind of between 5 and 10 years. But even above that, as Annie and Anya said, the chief medical officer of one of the hospitals that we partner with is in this program, and she has upwards of 20, 25, 30 years of work experience, but had a really specific reason she wanted to do this program. And so we see a very wide range on kind of the upper end of folks who want to apply this kind of knowledge, with the real hope that folks have at least 2 years to really benefit from the kind of experience that they're going to have within the MBA. Iris, what would you add to that?
Yeah, I would add the reason, we want to have that contextual understanding, right? Of what is an organization like, and work experience gives that to you. It also gives you an understanding of just the realities of an organization, of getting things done with and through other people in a complex organization with multiple stakeholders and consistent complexity, internal and external. And so that work experience also gives you the understanding that, you have to look at things from multiple perspectives. And sometimes it's not possible because of, some history or structure or regulation or consideration. And how do I work around that? And so work experience gives you that contextual understanding. And we want everybody in the classroom to have some access to that.
Awesome. Well, Iris, Anya, Annie, I can't thank you enough for having this conversation. I hope folks on the line feel as though they've learned more directly from Annie and Anya about this program. As I said, and I neglected to write my email address in the chat, despite saying that I was going to. I'm going to put my email address in the chat. I hope folks will be in touch with me about their curiosities, their personal questions, what they want to be thinking about as they navigate the consideration of this program. Anya and Annie also, they have lots of classmates who have been really generous about being willing to share their time and speak one-on-one to folks and who work in specific functional areas. I sometimes get the like, oh, I'm a physician's assistant. Can I speak to another physician's assistant or things like that? And so we certainly can work to support folks there. Um, I'm so grateful. If folks want to hang on the line, I see a couple more questions that I can answer individually and privately, meaning I'll write in the chat. So folks can stay on the line if they have a question in the chat that they want answered. But otherwise, I'll wish all the rest of you well, and thank you so much for joining us. Thanks, Anya. Thanks, Annie. Thanks, Iris.
Yeah,
Thank
thank you.
you.
Bye.
Bye.
Thank you.